Hello, everybody. Good evening. Dr. Rao here. And today is 51st day on the series of a tip a day on wellness up to 60 days. So we are entering the last but 1 week. So this is the penultimate week. And hopefully you're enjoying the series and getting something out of it. And today we're going to pay attention to herbal enhancements as a wellness tip. How can we really see the benefits of herbal and really get to integrate them into our daily life, if not make it completely, the whole thing. See, before you do anything with the herbs, always, always go to your physician, um, consult with him, tell him your plans, and ask him about what kind of side effects, what kind of ill effects these herbs can have, and then see whether any interactions with your medications before you start them. Don't listen to somebody on the social media and start them. Consult with your physician and then do it. Okay? So that is the warning that I always bring in. Why I was forced to look at them is one thing is a lot of my patients were taking them were when we take the inventory of the medications when they come to the clinic or the hospital, usually we ask them what are the over the counter medications you are taking, what are the uh, supplements you are taking, what are the herbal enhancements you are taking, and then how did you select them? What did you do to read the labels? Do you know there's a reputable producer whoever is selling these herbal enhancements? That helps a lot for them to be safe than getting hurt and then coming to us. Okay, but then there was another thing too. I did see this herbal use on many of the family members back in India, and also Chinese patients when they were coming. They were always bringing these herbal supplements or enhancements and telling us these herbal teas and what they are doing with these herbals in their food or whatever. They're helping them. So that anecdotal evidence was there. And also, uh, I discovered for the uh, PDR, like we have the modern medications here in English, but then we saw some of the PDR on the herbal medications in Germany. They have taken so much trouble to put a lot of resources to go through all the herbs and then find out what are the interactions, what are the side effects, and all that, right? So we kind of got familiar with it, and then we used that too. It was in the library. Okay, so be careful, be prudent, and then do it. Let's see what are the benefits. Some of them, obviously, it has that. Natural support for various health conditions. That's why people take them. But I'm not an expert about which condition really helps, which herb and all that. But only a few of them, like a blood pressure, a diabetes, there's few of them, immunity, some other, right? But then we know that it was helping some of the mental and emotional well-being. People use that to sleep. People use that to reduce their anxiety and depression and things like that. Okay, we heard about it, or we have seen reports from the patients too. And then it has some antioxidant properties which will help you with cancer prevention. That's why a lot of people take it. Okay, and then they have this support for chronic conditions, like I mentioned before. That was there. So all these benefits are there. But then, what are the popular herbal supplements and teas? That's something we can know. Chamomile, that's the tea that I've seen a lot of people use it. A lot of people claim that they have good effects of that. They have they calm you down. That's basically what it is, chamomile, right? And then it can reduce the stress and also promote sleep. That's why it's a calming tea that a lot of people use that. Okay, and then you have ginger, which is very much in vogue in Indian cooking anyway. So this is both as a supplement and as a tea. And ginger, if you are having digestive problems, you have nausea, you can take ginger and it will calm it down a little bit, right? And then turmeric, that's another one. Indian cooking has it all the time. This is a powerful anti-inflammatory and antioxidant too. That's why they use it in a lot of curries, a lot of ways people take it in, mix it in milk and all that, right? So it's a supplement or used in teas. And then echinacea, that is very popular, but the immune system, especially in flu season, people take that tea. And then peppermint, that's also it soothes digestive issues basically, and it also said to relieve headaches. Some of the people claim it. And then St. John's wort, that is something uh, antidepressant. So a lot of people with the depression they take it, but the thing is, it can have side effects with the blood pressure going up. So, and also it interacts with a lot of medication. So you definitely want to check with your doctor before you take this, St. John's wort. Okay. How are you going to integrate these herbal supplements and teas safely? Like we said, first of all, consult your healthcare provider and read the label carefully and make sure that they are coming from a reputable producer. And then start with a low dose. Don't take it too much. And also always know about the side effects and try to observe them if it's happening for you. And then you got to educate more. What are the benefits and potential risks? Like I said, newer PDFs and all those things, PDFs may have that. Okay. So how can you make this part of your daily routine is incorporated into daily habits like a turmeric, ginger, or their Indian cooking, Chinese cooking, and you can learn the recipes and use that, right? And then if you should have any symptoms, keep a symptom diary. That's important too, and report it to your healthcare clinic or provider. Okay. And always keep on informing yourself about what is going on with the field. And then if you develop side effects, if you really not worth it, don't stop, just stop it, but ask your physician and then taper it down. Okay. So these are all important things to understand the benefits and how you can incorporate them into your daily routine, what you can do responsibly to be safe from them. Okay. This is the tip I wanted to tell you about. How can you incorporate these herbal enhancements into your life? There are a lot of benefits, but there are a lot of care you have to take about side effects, about real ill effects and all that. Okay. So keeping the symptom diary, reporting to the is very important. We can go on each herbal supplements in a historical way, in a popular way of Indian thing is they just go to a person who gives them all these herbs, and he doesn't charge, because his only job is to get up in the morning and go to a forest, and he is very knowledgeable about the plants and their herbal properties. So he knows what disease, how to cure with the bark or leaf or root of a plant, and then he will go hunting for those plants in the forest, and he goes deep in there and then gets those rare herbs, right? And then he brings them in a small bag, and then he opens his clinic, and then each person comes and he will look at their pulse, and then they are very adapted to diagnosing things with the pulse. And after he does that, he gives that herb cheaply, or not cheaply, it's freely. He never takes the money, right? So that's exceptional doctors that they have done this herbal supplements enhancements for also cures, right? For centuries. So they have done that. So that kind of knowledge is very uh, difficult for us to go, and because they don't write, they just learn from their own experience, and then they have learned from their teachers, so they kind of kept that knowledge very sacred and secret. So we may get some of it but not all of it, but then when they practice this medicine, they thousands they cure, maybe a few of them develop problems. So other thing is they do it everything freely out of love and compassion to humanity. And I call them the real doctors, really, And then you can see many of the people, they go there and they take whatever he gives, and then they maybe some placebo effect is there, but then a lot of people report improvement, and they come back to him again and again. Okay, so that is also very fascinating to me as a physician. How do they get this natural drugs? Our medications also mainly from the plants, right? Now we may have a synthetically growing some of them, but basically most of them are from the plants, right? So that's what we need to understand. And people who are very knowledgeable about this plant kingdom and having the knowledge of medicinal properties of the parts of the plant, I think they were doing that, but then people also nefarious people, they kind of take advantage of this belief of these people in these medications, and then they produce with not with really uh, care, but they can have pollutants that are harmful to people. So be careful. Okay, so that's what I wanted to tell you today, and I will see you again tomorrow with the number 52 tip. Okay, thank you. Bye bye.